Hey guys, it's Patrick from Fix You Physio in Sligo and in Letterkenny. So we've been getting lots of messages in about some of the knee anatomy videos that we've published, and some of the questions have been more targeting toward the meniscus. Some people are questioning, or is the meniscus part of the cartilage in your knee? Does everyone have a meniscus? Can it be possible for your meniscus to erode away? So what I've decided to do is go back to the knee model and show you exactly where your meniscus is. So on your knee, if this is looking at the front of your leg and you can feel your kneecap on the front, then your thigh or your thigh bone is called your femur and it comes down, and your shin bone comes up from your ankle and it joins in the middle to make your knee joint. And the bone on the side is your fibula, sliding, floating bone. And your kneecap has your patella tendon going over it and up into your quad muscles. So at the end of this bone here, your femur, then you have the end of that bone, which is down here. And all this smooth surface here is going to be cartilage. And that cartilage is independent to the meniscus. So people can have cartilage damage like arthritis, or different bone bruises, bony edema underneath the cartilage, and different things specific to this. And then you can have a problem with your meniscus, which is this blue part that you can see on both sides. And they look like two little cups. And you can see that blue goes all the way around the knee, in behind and into the other side. So it acts like a little shock absorber, and it also gives a little bit more congruency to the joint so that this stays in here a little bit more easily. And this slides on top, but the meniscus is kind of connected, so it doesn't slide around. And when you're moving, that bone on top can move and slide forwards on the meniscus like that, because you've got lots of nice synovial fluid in here. So a healthy meniscus will look like this, and it'll look very, very defined. And what can happen with this is you can have tears. So sometimes in this little point, say on the inside circle here, you can have some little tears, like little kind of fishery tears, that give you some complications. Or you can actually have on the inside of this meniscus here, if you look at that there, if you split it in two along here, then you can have what's called a bucket handle tear. And sometimes that flap then can overlap on the inside. And sometimes the crack or pop you can hear in your knee, or the knee gives way, is to do with the stability your knee feels when you've got a damaged meniscus. So for someone that has a damaged meniscus, years ago the surgical approach was keyhole surgery called an arthroscopy, where they've got some instruments that go inside your knee, and they've got different tools that they could cut and take out that damaged meniscus. But what in some instances now, and research is saying, is that preserving the meniscus can be quite beneficial to a lot of people. So depending on your surgeon and his or her decision to repair or to remove the meniscus, it'll be made on your case. But sometimes they can put in sutures or stitches, very strong stitches, to connect where that would have split the whole way around, and thus by restoring the integrity of that meniscus and giving your knee a little bit more of its kind of predisposed structural path. So with meniscus tears, sometimes you can have a little tear on the side, and there's different things that can tear. But in terms of research, there's the only difference between having surgery is that surgery will make you feel better sooner. But with a lot of research, 12 months post-surgery, people that rehab through physio strengthening exercises are people who have surgery and then do the rehab afterwards. There's not a lot of difference in that 12-month window. So depending on you, rehabbing with specific strengthening exercises for your knee, hip and ankle might be your best protocol, or depending on your surgeon's recommendations, maybe the removal of that meniscus might be the best for your case as well. So if we ever get someone presenting to us with knee pain that locks, your knee gives way, you've got a sharp pain on the inside, there's different tests and orthopedic tests that we can use to figure out exactly what structure is damaged and where. So a lot of the times, if we have to send you for an X-ray or an MRI or anything else, we'll have a high suspicion of you having a meniscus tear, for example. and you're sending that patient for a scan to find out if you're right or the extent of your suspicion. And then depending on that, then you might need to send that patient for a surgical review straight away, or you might advise physio, depending on the outcome of that scan and your presentation of the patient. So if you have any problems with your knee and you want to ask some questions, by all means send us some Fix You Physio Facebook messages and we'll get back to you, or alternatively call us and we'll answer the phone, or we'll schedule an appointment with one of our Fix You physiotherapists can call you back and have a question and answer session about your knee. Knees tend to respond really well to strengthening exercises, and there's lots of evidence in my experience of treating knees, and also in terms of research as well, that strength-based and specific strengthening exercises can work really well for your knee pain. So I hope you found this video useful. If you've got any questions or comments, please comment in the box below, and if you've got any questions for us, make sure you send them to us.